Welcome everybody. My name is Dr. Joshua Golden, and I want to introduce you to dentistry. Most people, when they enter the dental office, they are afraid, literally scared out of their mind. What I like to do today is literally show you step by step of what it takes to walk through that dental door and start treatment. So step one, you gotta walk through the front door. I always think about it myself. When I was younger, I never wanted to walk into the dental office. That door was a barrier for me. So literally putting your hand out and opening that door is a huge bonus. So once you're walking into the dental office, you're getting a lot of sights and smells and sounds, and the fear is, again, unreal. So in my office, you're gonna be greeted by a lovely young lady who's going to help you get your paperwork started. We're using now an iPad where you'll put in your health history and any dental trauma that you've had, and basically giving us a nice workup of what we have going on with our patient. After that's done, you'll hand that iPad back to the front desk, and then you'll wait to be called by one of my amazing dental assistants. After that, we're gonna go ahead and we're gonna walk towards the x-ray room. My dental assistant will kindly sit you down, and then at that point, we'll take what we call a selfie. You'll take a selfie so that we can always have a picture that's associated with your chart. What we'll do is we'll take an FMX, which is a full mouth series of x-rays, so that we can see your teeth from multiple angles.
So my name is Valea. I'm gonna be taking your x-rays today, okay? So I'm gonna start off with your blood pressure. It goes right on your wrist. Okay, so while we wait for that, I'm just gonna start setting up to take your x-rays. Okay, blood pressure is all done. Good. So we're gonna start off with the first x-ray. So this is gonna spin around and take a 360 image of your teeth. I'm gonna have you stand up and come right under here. So I'm gonna put this over you. It's just gonna protect you from radiation. So I'm gonna put this up. And then I'm gonna have you bite right in between there. Okay, so I'm gonna take this off you. That one wasn't too bad, right?
Yes, people hate taking x-rays. I get it. One person told me they felt like it was biting down on a razor blade, and I thought that was really crazy, but I can see where they were going with it. So my team's super skilled, so they'll make sure they add a little bump or barrier to make sure when you're biting, it's nice and soft and it's like biting onto a pillow. So after we take a series of x-rays, we also take what's called a pano. This is an x-ray that goes around your head. This x-ray goes around your head and it gives us basically an overall big picture of what's going on in your mouth, allowing us to see if there's any abnormalities or any infections under the gums.
Okay, so we're gonna start with some more of your x-rays. They're a little bit uncomfortable, okay? So just let me know if you need a break. Okay, ready? You're just gonna put this in and open wide and bite down and hold that for 2 seconds. Okay, and open. That wasn't too bad, right? So we're gonna move on to the next one and hold that right there. Okay, and open.
That x-ray's done. You've taken your FMX, and now we're gonna go ahead and we need to sanitize the room. We wanna make sure everyone gets a nice clean room. And while our patients are waiting for that, we have our family wall. This allows you to get to know us. You'll see tons of pictures from my office manager skydiving, or you'll see pictures of my boys, or the rest of my team's family. We feel that this is a great way to help you connect better with us. So once we are in that room, everything is easy peasy.
You're all done, you did great. So I'm just gonna have you stand right outside this wall. You can look at our family pictures while I clean our room.
Now, it's time to walk into the exam room. This is another area that's very, very daunting for most patients. When we're walking into this room, you're seeing all types of crazy things, from instruments to a suction to even a TV. So naturally, you want to just kind of sit on the outside of the room, but you really need to sit into this beautiful chair that's right here, which helps you relax and lean back.
So I'm gonna give you these patient goggles. It's just for the light.
Once you're in this chair, it's the doctor's job to help you relax. We want to ensure that you know that you're in a safe, comfortable space. And then we're going to talk about what we see from the x-rays that you took. So again, now at this point, I always tell my patients, I want you to breathe. I want you to close your eyes, and then I want you to lean back.
Okay, so I'm gonna give you your bib. This is just gonna go around you. Okay, let me pull up your x-rays. Okay, so I'll let Dr. know you're ready, okay? Be right back.
All right, how you doing? I'm Dr. Golden. I'm happy to have you in today. How'd you enjoy your x-rays? Were they fun? Awesome. So Leah told me some great things about you. I also saw that you got a missing tooth on the lower right side. Let's see what we can do to help you out with that, okay? All right. Thank you for taking time out of your busy schedule. I hope you enjoyed the content that we provided today. And if you want to find out more about what we have coming up, please like, subscribe, and comment below and let them know who your golden dentist is.